couple years, I get to do a grand rounds for one of our local major health systems. And so I got to do grand rounds this morning with some of the MedStar urogynecologists. And what's very cool is that's where I started my pelvic health career. And so one of the urogynecologists, Dr. Charlotte Glacia, who I, again, have worked with my entire career, she was leading in the meeting. And essentially, it's kind of a little bit of an impossible thing. They're like, hey, in 30 minutes, tell everybody what pelvic floor physical therapy does. What were the other questions? Like, what's an evaluation look like? What are the exercises you give people? And what should we tell people when it takes too long to get into pelvic floor PT? So I'm supposed to answer all these questions in 30 minutes, which is kind of impossible. But it's also a really cool time to chat about, hey, this might be what you were taught in school about what pelvic floor PT does, because MedStars, they do have a pretty big teaching program. And this is what we actually do. And you never know kind of what's going to come up. But today we got to talk about lifting and how, in the context of leakage and prolapse, really for a very, very long time, it's like, no, you shouldn't be lifting, or, after surgeries, you shouldn't ever lift this much again. And we just, if we go back and look at the data on lifting and prolapse, it's occupational health data. It's not, lifting for exercise or things like that. If we look at after surgery, we just didn't have women that were active. And now we have women who, they're having surgeries to manage anatomical prolapse or leakage or things like that. And they want to get back to exercise. And we do have more data. So it was really nice today to quote some of Christina Previtt's work, Lori Forner's work, Margie Davenport's work, researchers that we've had on the podcast, and just really be clear that, we do things a lot differently. And I never shy away from a time to reflect on, my very first pelvic health experience being tucked away in the corner of that very urogynecologist's office with a biofeedback machine, a tiny little office, and not really room to move. And no, there were no weights. There were no things to lift. There was not really, the only exercise we did were really just kind of stretches, which is kind of nothing. So it's very cool to be asked to do these things and talk to these people that are kind of new in this space, or have been there for a long time. And what are the changes, but also to reflect on how far things have come. But yeah, super cool that people are having these conversations. They also talked about, looking at newer genetic technologies like PRP for tissue injuries, birth injuries. I'm actually going to be talking to Dr. Imran Siddiqui next week, who is a physician here in the DC area who's doing more work pelvic-wise. He comes from Ortholand, and lots of times, we learn about, or we come up with new ideas on what to do with the pelvic floor based on what we're learning in orthopedics, because is a muscle just a muscle? Like, it is. And so anyway, it sounds like more and more people are interested in kind of looking at that as well. So if you want to learn more about exercise in pregnancy, exercise in postpartum, definitely check out the podcast episodes with Christina, with Margie. We haven't had Lori on yet. I do want to, she just finished up, she's wrapping up her dissertation in Australia. Hopefully, now that Lake's come down, we can get her on the podcast, but then also coming up with Dr. Siddiqui. So if you have questions about lifting, pregnancy, postpartum, prolapse, stress urinary incontinence, let me know.